Afternoon, everybody. Welcome back from lunch. So the first session after lunch. Quickly, you know the drill now. Questions, put them on Slido. If time at the end, we'll call those out. But you're free to sort of stick your hand up at the end as well to ask questions that way. So it's now just for me to welcome Meqele. We're just having a conversation, not about Meqele's first name, but how you pronounce, and I've got it here, Bleasdille. So I just made a right hash of that. But Meqele from TELUS Health, Strategy and Engagement Consultant. So over to you.
Thank you so much, Richard. Can you all hear me? So I can hear myself. Yeah, perfect. So thank you everyone for joining my session today. Today we're talking about scaling mental health globally. I'm Meqele. I've been in the EAP and wellbeing industry for about 12 years now. So I'd give you a little background about my experience. I started my EAP and wellbeing career about 12 years ago. I was actually working for Workplace Options, which has just been acquired by TELUS Health, and some of you might be aware. So a bit of a full circle moment for me. But my first job there was managing the service delivery and quality of calls that were coming via the service centre. So I got to hear thousands of calls firsthand of people in their most vulnerable moments as they would reach out for help and asking for support using our services. Fast forward, did a few jobs in there, so account management, directive account management even, and then I decided, let me actually put into practice all the things that we've been talking about and things that we tell clients to do. So I spent about four or so years working as an international wellbeing program manager for a US-based airline, a fantastic airline, and there was no global mandate before I joined, and so my job was to create and deliver the wellbeing strategy for a global population. And let me tell you, we learned a lot of things along the way. It was an experience, and I can say it was a while ago now, so I'm going to share with you some of the mistakes I made and why it's really important to think inclusively, in particular when you are building a wellbeing strategy globally. But today, my job at TELUS Health is to support multinational clients with complex needs, to really elevate their wellbeing strategies and get people engaged and ultimately using their benefits and using their EAPs and wellbeing programs. So I get to work with a number of organisations, and we share a lot of ideas and we talk a lot and we essentially grow together. What we're going to be talking about today, I'm going to discuss the current state of mental health and well-being. I'm going to talk to you about why a blended approach works. That means the proactive and the reactive. I'm going to talk to you about why it's important to build an ecosystem as well. Show you practical frameworks for impact. It's really important that we have a cohesive framework, and give you some things that you can stress test your strategy with. I'm going to talk to you about why it's important to be inclusive when you are building a global program, and I'll share with you some of the anecdotes of things I learned along the way. And lastly, we'll round up by talking about how you can make sure you choose the right partner to work with, and some of the questions that you should be asking some of your providers as and when you start to work with them. So, in terms of the new mental health mandate, well, let's begin with some stats, if you like. And this is taken from our most recent mental health index for Pan-Europe. We survey, we provide this information across the globe. We do lots of different surveys. You can download them from our website and find out some more information if you have a particular region that you're interested in. But for the most part, well, we've surveyed thousands of employees, and not just people that work for us, it's general population. And we asked them a series of questions to understand their current state of well-being. And the results are compelling. So as you can see here, health and financial concerns are the most common source of personal stress. A third of workers feel overwhelmed by their responsibilities, with disproportionate people concern around younger workers and parents. At least 1 in 5 parents of school-aged kids, teens, and young adults are concerned about their children's mental health. And improving fitness, nutrition, and weight loss are the top lifestyle goals that workers have set for themselves. That's definitely me every year, every time. The fact is, people's needs are varied, and challenges can come from all different aspects of life, and it can have a really significant impact on your mental well-being. And there are broader factors that we haven't considered here. So think about the geopolitical instability and how that's impacting people, the cost of living crisis, the sheer access of the wealth of information that people have access to. Mental health is more crucial than ever. And I speak to HR leaders and benefits leaders every day. And for the most part, we're no longer talking about if we need to have a mental health strategy in place. That is unless you're talking to procurement, who somehow don't get it. I wish they would come to these events more often, actually, so they can just be on our side a little bit more. For the most part, they're no longer asking if we need to have a mental health strategy, but rather how do we ensure that the one that we do have in place is inclusive, that it's robust, and of course scalable as well. So let's think about why and how a blended approach works. So let's begin thinking about the proactive and the reactive support. So think of it like this way. Proactive support helps us build strength and resilience. And of course, the reactive support helps us in our time of need. And so they help us support and aid recovery. Neither of these is optional. Proactive things might include things like stress resiliency training, digital wellbeing check-ins using maybe a wellbeing app perhaps. Reactive care is what we rely on when somebody is in need of help. So yes, things like counselling, referrals to specialist organisations, people that can provide them intervention support as well. And if we only focus on the reactive, then essentially we're just firefighting. And if we focus only on the preventative care, then essentially we might run the risk of being ill-prepared when somebody that has more complex needs arises. So we have to consider both. And the future of organisational resilience requires us to have both. And we need to build systems that support people not just in their time of need, but they can also support before things go wrong and respond quickly and effectively when they do. So, in terms of building a scalable ecosystem, we need to have one that combines both digital technology as well as human care. A stepped care model approach works well here. So as you can see, think of it like a pyramid. Think of it like this pyramid, but backwards actually, because I've got the graphics a little bit wrong on this one. But on one level, you have things like on-demand care and support, so self-care, online resources, online access to self-guided tools and resources. On the next level, you might have things like group support, group coaching, if you just need a little bit of motivation to help you get to a particular life goal. And on the next level, you have things like clinical support, so interventions when somebody needs to speak to a counsellor, perhaps. People can enter the pyramid at any stage that they need to, and of course, we want them to move up and down depending on what their needs are. But digital platforms really help us to scale this. So things like having apps, on-demand content as well, help us to transcend really across different time zones and different locations. But having said all that, the human connection remains possible. I've been speaking to a lot of people about that today. Oh, we're all talking about technology. I think there have been a lot of talks about technology today and AI, but human care still remains vital, so it's not replaceable. We want to make sure that people still have access to speak to an individual person when they need help at any time of day. So that is through things like EAP support, or coaching, or being able to have telephonic support. Some people are still doing face-to-face. We're still seeing people engage in face-to-face counselling in a lot of locations. So digital technology doesn't replace care. It simply enhances it. And as organisations grow across borders, so do their complexities, or the complexities around mental health in general. And in order to truly scale globally, we need to build systems we need to have more than just a collection of supports available. So we've been talking to a lot of clients today who said, we have a lot of products, we have a lot of programs, but we need to make sure they actually exist as part of a cohesive framework. And we want them to be data informed. Yes, we want them to be able to measure uptake, engagement. We want to be able to measure impact and results, etc. But they should also align with global consistency and local nuance. And I'm going to come on to that in a bit more detail in just a moment. But the key to all of this is integration. A strong mental health framework is one that's going to be able to connect all of these layers together. So the proactive and the reactive, of course, with clear governance, good accountability, and data-driven decision-making as well. And as we said in the last slide, it should be tiered so people can access the right level of support at the right time and in the right way that suits them. So let's think about what actually works then. So I've come up with these 5 R's. Some of them I'll admit are a bit of a stretch, but bear with me on this one. This can help you stress test your strategy. So first R being reach. So is the solution that you're providing accessible across multiple populations? The next R is relevance. Does it align with real employee needs and their cultural expectations? And that is so important. And we'll talk about why in just a moment. Responsiveness, so can people get timely support when they need it? So whether that's on demand in the comfort of their smartphone, or if they need to speak to somebody in the middle of the night. Also results. We get a lot of data from our providers, and providers are providing all sorts of information, but are we also measuring the impact and the outcomes? So we need to make sure that we are measuring impact. And then repeatability. So can the solutions scale across different regions and across different demographics and different environments as well? And you've got to think about that in tandem with the relevance as well. So you've got to make sure that, yes, you want it to be scalable and across different populations and demographics, but keeping in mind you need it to be culturally relevant and culturally intelligent. And thinking like this will help you move from having just good intentions to measurable outcomes, and help you turn your well-being strategy into an engine for business performance. So, inclusion is my favorite topic to talk about. One of the most common challenges we get asked about is how do we support a global diverse workforce equally? Now, I do take issue with the word equally, and will become clear why. But inclusion starts with access. So that means having things like apps, of course, local language, providing for language support, digital accessibility, but that also means addressing things like people's time zones, different cultures, people's different working patterns. It also means addressing things like neurodiversity and gender-specific challenges. We've recently partnered with Vera Health, or Stella, some of you might know it as Stella. So we're able to provide a more comprehensive women's health support system, which really complements our EAP. But not just that, also frontline workers, people that aren't sat behind a desk. That's probably the most common thing I get asked by my clients. How do we support blue-collar workers, and what can we do to better engage with them? And importantly, as we scale globally, we've got to stay culturally intelligent. What works in one country may not resonate in another country. And that's why localization through delivery, sensitivity to stigma in particular, is non-negotiable. And you've got to make sure that you're engaging with local people, local champions, local HR representatives to help you build trust and really drive engagement. And I'm going to share with you a couple of examples of some really fun experiences I had, not so much, as the International Wellbeing Program Manager. As I said, I came on board as the global international program manager. There wasn't one before, and it was a US-based airline. So as you can imagine, everything was in America, and nobody else got anything else. And you were looking from the sidelines like, oh, I wish we had all the things America had. So then I came on board, and the objective or the directive was to have global parity wherever possible. So we said, we're going to make sure that we have everything equal to, or as close as possible to equal to, everything that we have in America. Example number one. We decided to roll out on-site counselling. And we said, we'll do this globally in our most populous countries. So we picked our top 10 most populous countries and said, we're going to make sure that these countries have access to an on-site counsellor 8 hours a day, a couple times a month. And included in the list of countries that we decided to roll this out in was Japan. Now, I don't know if any of you have worked with Japan before, but that is a country that in general has real challenges around stigma around mental health in general. Yes, we know that they've got super high suicide rates amongst men in particular, but in terms of accessing support, people are more likely to engage with their family members inside the home and not really disclose that sort of sentiment with anything to do with work. But in our infinite wisdom, we decided, well, what they really need is to have somebody come on site 8 hours, and so that will help boost engagement. And to our surprise, nobody used it. And that was something that we would have known if we just paid attention to what the data was already telling us and what the local people were already telling us, that people are very unlikely to leave their desk, tell their managers, I'm off to have a mental health support service with the counselling session with a counsellor in my working hours. We would have known better. We wasted resources essentially, and we could have targeted better in terms of on-site doctors, etc. instead. So lesson learned in that sense. Example number two, there was more. We also launched a global wellbeing app. So there was one in America, we scrapped it, and we said, nope, we're going to offer one to everybody everywhere. And it was going to be fantastic. And we said that as part of participation or to drive engagement, we are going to reward everybody everywhere with $500 for participating and engaging with wellbeing programs via the app. Sounds fantastic. Now, $500 in America is $500, right? $500 in the UK, 350 quid at the time, maybe. Yeah, not so bad. $500 in the Philippines. It's a lot of money. And you'd think, oh, great for them, why not? Yeah. But what it actually meant is that people had really severe tax implications, and they actually were getting taxed significantly because that could equate to, in some cases, a month's wages or the equivalent to a month's wages. So then we had to backtrack, engage with payroll and finance and talk to people about, oh, what do we do in this instance? We need to inform people that they need to make sure that they speak to somebody to understand how their taxes work. And what actually happened in the end was that people felt hesitant about engaging with the app after all the shine wore off of getting the $500. So I say all of that to say that when mental health strategies are designed to be inclusive from the start and not retrofitted afterwards in the way that the examples that I've just given you, it reaches more people, it's trusted. So it's not just a social good, something we do because it's the right thing to do, it's actually a strategic necessity and will help you avoid the mistakes that I did. And in the same breath, it's really important to have continuous feedback loops as well. So I mentioned talking to the right people, but we want to have what we call always-on listening. So making sure that we are taking part or utilising or leveraging all the different touch points we have to get as much information and feedback as possible. If we want to keep our strategies relevant, annual surveys aren't enough anymore. So we need to do things like, yes, digital wellbeing check-ins, using your apps and your tools. We want to do things like manager pulse surveys. They're fantastic. But yes, look at the EAP data, look at the utilisation trends, have a think about what people are accessing, what's important to them, and what's changing month on month. And I won't say who, but I have a client in the room where we look at the data month on month and we see what's happening and what's changing and what's going up and down. And these help us to pivot fast and adjust our strategy. So I've been working with a number of clients actually on targeted outreach projects where we speak to individual country leaders and we ask them specifically what is working and what isn't working in this particular country. Why is the utilization or the engagement low or no? And what can we do to better support you? And those conversations have been really insightful. On the one hand, you might have somebody that says, you know, I actually haven't done anything and that's why there's no engagement. No, we haven't printed a single poster or flyer and we haven't done any talks about it. It's like, okay, good to know. We might be engaging with the wrong people. Or it might be that, time constraints or misunderstanding, or we've had a lot of conversations in different APAC countries where that conversation around stigma has come up from time and time again. So, but that information has been really valuable and helped us pivot fast and adjust our strategies moving forward. And when employees and leaders and HR leaders in different countries feel that their feedback is being acted on, then trust increases. And trust is really the foundation of engagement. And it's how we make well-being programs not just available and there, but something that people actually want to use, something they engage with, and they appreciate it. And it's really loved by those people it's intended for. Right, so choosing the right wellbeing partner is going to help you immensely with your strategy because there are a lot of vendors out there, a lot of vendors here even. I'm sure you've had some great conversations with a lot of people today, but not all partners are created equal. But you do want a partner that can really help meet your needs as they are today, but grow with you. It's been exciting to talk to people about their vision, what their long-term goals are, how they see AI or how they see digitalization supporting their workforces. And it's made us think about how we can better connect people with the right resources within TELUS Health to be able to develop those strategies and help people achieve their goals. So what you do need is a partner that will help you meet your needs, but grow with you. So global footprint, as we know, but local nuance is incredibly important. Digital tools as well as human care, data security and good clinical governance, and importantly, the ability to deliver real measurable results as well. So you need to be asking the providers that you work with, how do you support early intervention? Ask them outright, what do you do and what support services do you have? How do you track outcomes? So you're not just looking at the data, what else are you providing? And can you integrate with our systems, whether it's Workday or something else that you have? Is there any level of integration? I think I spoke to a couple of people today as well who just talked about being overwhelmed with the various touch points that people have to be able to get the right care. So looking at care pathways and why it's so important to be able to, for people to access the support they need easily and seamlessly. But also ask them, how do you support our most vulnerable employee groups, whether that's gender, whether it's sexual orientation, whether it's people that are not sat behind a desk, so people that really need protection. What else are you providing that you can support us with this? So your wellbeing provider shouldn't just be offering services to you, they should be helping you build a long-term strategy. And make sure you talk to your relationship managers as well. They should be meeting with you regularly. You know, I speak to people that say, oh, I'm not really sure who our provider is and I don't really get much data. Talk to them and ask them for it, and make sure that they are analysing the data with you. They're making recommendations based on their insights, and they're helping you offer alternative solutions where things are not working the way we want them to, or where we want to pivot and change things. They should be able to come up with solutions that are really going to match your needs. So it's really important to engage with your partners and not just ask them questions, but hold them to account as well. So, let me tell you a little bit about TELUS Health. Well, we are a global wellbeing solution provider, and our mission is to be the most trusted wellbeing provider in the world. And we do that through building healthy communities, we give where we live, but also healthy workforces. And our level of support that we provide to employers is, well, it's a full wraparound care, so that you can provide employees not just preventative support, but also everything through to crisis support as and when you need it. So ultimately, we want to make sure that we're building a culture of positive well-being within your organizations. And alongside a traditional EAP, we have a number of different solutions, but I'll try and keep it simple for now. And if you have any more questions about something specific, then by all means, you can speak to us downstairs. But alongside the traditional EAP, which you expect 24/7 outreach to EAP specialists, we also have two digital solutions in particular that I wanted to mention today. The first one is TELUS Health One, and that has things like online content, videos, articles, podcasts, self-guided CBT programs, the total wellbeing assessment to understand your current state of well-being, toolkits, resources for managers, all sorts of information, really, really comprehensive, available in multiple languages as well. I think over 60 languages. But the other program I wanted to talk to you briefly about is, missing a slide, that's all right. It's TELUS Health Engage. Now, TELUS Health Engage is a proven digital platform that's designed to help people like yourselves, forward-thinking HR teams as well. It's backed by behavioral science, and you're able to access a lot of content on there from sleep, mindfulness, physical activity, all the things that we know that people are really interested in improving in terms of their lifestyle goals. It's really based on the individual's preferences. So I can just say that I want to be more motivated, I want to reduce stress, I want to sleep better, and then the content is curated to match my needs, and it guides me through a journey, and it's really great in that sense. And of course, that human touch is important. We've got the integration with the EAP, so you'll still have that human care 24/7 support as you'd expect to have. And from an employer perspective, we know that this app in particular garners results. It's been proven to reduce sick days by up to 2 per year per employee. There is a built-in ROI calculator as well, over £400 per employee per year. And that's something that's based on your own data, so you can look at that and you can help with those conversations that you have with procurement as to why on earth you're spending so much money on EAP, why do we need it? And when using these programs, your employees ultimately would get a program they actually use, because as I said, it's curated for them and they're based on their interests, and you'll get a culture of well-being as well that prioritizes well-being. So, key takeaways. What have we discussed today? Bringing it all together. We know that blending proactive and reactive support is going to help you with long-term organisational resilience. We know that using frameworks like those 5 R's that we mentioned before are going to help you with your strategy and with your stress test. Design for inclusion from the start and don't retrofit it afterwards. Talk to your people leaders, so that you're not having to shift things around and change things around afterwards. Listen continuously and improve often. So keep those conversations going with your local team so you know what the current sentiment is, how people are engaging and what matters to them and what's important to them. And lastly, choose providers that are actually going to align with your own organisational goals and your vision, your long-term vision, and use them to help build your strategy with you. Because when well-being works, it works for everybody. It works for you, it works for your teams, it works for your culture, and of course, ultimately for your business's bottom line. That's all from me today. Please take some time to download the ebook that we have there. It's on holistic health, the intersection of employee mental, physical and financial well-being. And we are also downstairs, just in front of the stairs, if you like. If you go down that way, we are just in front of the stairs by the other room. Do we have a couple of questions? Any questions?
That was such a good summary right at the end there. I think we'll go over it. There were a couple of questions, but we're right on time now.
Okay.
So I just want to say, Meqele, thank you very much. That was so good, particularly the 5 hours framework. I thought, I've not thought about it like that before. So, and as you've said, you're downstairs with your colleagues, so
We are.
plenty of time to follow up. So, Meqele, thank you very much.
Yeah, I see some great questions. Come downstairs and ask us in a minute. Thank you, everyone.